Oh. Hi everyone, my name is Joey and I'm an ENT trainee from Auckland. Really glad to be here to talk to you guys about CTs and MRIs of sinuses. It's really important to recognise the landmarks when you perform a segmentation in CT and MRI. And coincidentally, the landmarks that are found useful are really important key areas that surgeons use when they perform an operation. So the septum, inferior middle turbinates, those are the side projections that come in from the side of the nasal wall. The frontal sinuses, so the sinuses at the top in the frontal bone, like in the forehead. The frontal recess, which is how the frontal sinuses drain into the nasal cavity. The osteomeatal complex, which I'll talk a bit more about later, it consists of many important structures. And then the uncinate process. So first we'll look at some CT sinuses, or a CT sinus scan. We won't talk about the pathology at all, but some of you might notice that there is some inflamed sinuses. So starting from the front, because we always look at a CT sinus scan from the front going to the back. At the top, you got the nasal bone, so that's white, and the nasal septum in the middle, that's the partition wall, and in this area it's all cartilaginous, and then you've got the alar lateral cartilage, which is cartilaginous, or the soft part of the external nose. And then if you keep going back, then you start to see frontal sinuses, so these are the sinuses that appear first. And again, you see the nasal septum, and you start to see a bit of white there, which is bone, and that's called the perpendicular plate of the ethmoid, which is a projection that comes down from the ethmoid bone in the skull base. And then you also start to see the front, or the anterior part of the inferior turbinate. Those are the side projections. Going a bit further back, this is a really busy slide, but it's actually one of the key slices. A lot of anatomy happening. So if we start from the top, you've got the frontal sinuses, and you can see that the sinus on the left side here is very, very full of stuff, so probably got sinusitis there. But at the top, it's always the frontal sinuses, and you can see that there's a subtle difference between the left side and the right side. So on the right, you can see that there's bone continuity in the floor of the frontal sinuses, going from the midline out to the orbit. So that's the eye there. Whereas on this side, you've got that loss of continuity of the bone. So that's how you identify where the frontal sinus drains into the nasal cavity, and we call that the frontal recess, and going downwards, that's the frontal sinus drainage pathway. So when we operate on the frontal sinuses, that's one of the areas that we try to widen when someone's got frontal sinus disease, and it's actually a really tricky anatomical area even for surgeons to figure out. And then this here, ANC, it stands for agonase cell. Basically, people call it the most anterior ethmoidal cell, air cell. And so the ethmoidal sinuses are the sinuses that are in between the orbit and the midline, the septum area. And then going further down, you guys probably know this is the maxillary sinus. So these are the sinuses in the cheeks. And then inferior turbinate again, and you can see that in this area, the inferior turbinate, it's quite vertical, so we call it like the vertical lamella of the inferior turbinate. And then this don't have to worry about, it just stands for the nasolacrimal duct, which is the tear duct. On the side view, so that's the sagittal orientation, we can see that we're actually looking in this particular slice here, where we could see the frontal sinus at the top, the agonase cell, and then inferior turbinate. And when you move further back, you can see the frontal recess. So you can see it's very, very thin. So you can only probably identify it on a couple of slices in CT and MRI scan. And then moving further back, you've got the ethmoidal sinuses, because this is in the midline, and then the sphenoid sinus. And you can see how they all nicely, in a normal person, would drain into the nasal cavity. Going a bit more back, we've got this, which is the uncinate process. And this is a really tricky bone to understand because I'll show you on the next slide, but in this slice, you can see that it's attached to the inferior turbinate below, and then it goes upwards. And the superior attachment or the above attachment is really hard to understand, but it can basically branch out to 3 different areas. It can either go to the orbit, the roof, or the ethmoid area, or to the middle turbinate. And why this is important to us is because it tells us how the frontal sinus drains into the nasal cavity. ION, that's just a nerve, and yeah, maxillary sinus again. And I highlighted the middle turbinate because I wanted to show you that the middle turbinate near the front is vertical, and we call that the first part of the middle turbinate, and it attaches to the roof, ethmoidal roof, and this little gap between the middle turbinate and the septum is what we've been talking about, the olfactory region. So here, the bone is called the cribriform plate. That's the sieve that Narinder mentioned, and that's where nerves will go from the nasal cavity into the brain and the olfactory bulb to tell us what we're smelling. Okay, so this slide I was just trying to explain the anatomy of the uncinate process. So it's a sickle cell shaped bone, and the inferior attachment is on the inferior turbinate. That's what we've seen earlier, and you can see that it goes up in a sickle cell shape into like the roof area, or it can go to the middle turbinate or on the orbit. Normally, this is covered by mucosa, so it's covered by tissue like this pink tissue, so you wouldn't see that hole there on the endoscopic view. So this is an endoscopic view with a camera that we've all seen today. It's the right nostril, so that's the septum, a middle turbinate projecting downwards from the roof of the nasal cavity, and then this is the uncinate process from front to back. You can see it's a sickle cell shape, and this anatomical region is important because in this area you've got the maxillary sinus behind. It drains into the nasal cavity this way, and this airspace here, we call it the semilunar hiatus because it's like a half crescent moon shape. And the uncinate process is this piece of bone here. Going further back, this is the other really important slice that you'll come to when you do your segmentation, because again, lots happening, and we call it the osteomeatal complex. It's a complex of structures that where basically a lot of drainage pathways will converge. So we'll start looking at the maxillary sinuses on the left and the right. This is a maxillary sinus ostium, so it's a hole by which the maxillary sinus will drain into the nasal cavity. But you can see that there are a lot of structures that surround it, and you can imagine if they get swollen by inflammation, then they'll block that pathway off. So in the most limited form of endoscopic sinus surgery, we concentrate on this area, and it relieves a lot of patients' symptoms. So the structures I'm talking about are the middle turbinate, which we all know about now, the uncinate process, and then this area is the ethmoid bulla. So that's like the middle ethmoidal air cells. It's where most of the ethmoidal air cells are. And on the other side, that's also the uncinate process. That would be where the maxillary sinus drains, ethmoid sinus drains, and so on. Bit further back, this isn't really important for us when we do a segmentation in terms of like the anatomy, but for surgeons it is. It's the anterior ethmoidal artery, and we see what we call like the nipple sign. So that's the artery there, and we can see that the bones make that beak shape, or nipple shape. And going a bit more further back, starting at the top, this is the LP, lamina papyracea. So lamina papyracea, papyracea means paper, I think, so it's very, very thin. It's the most medial part of the orbit, and that's important for surgeons. So if your surgery is quite extensive, then that's the best way to explain it. If it's quite extensive, then you can damage the orbit. And then this BL stands for basal lamella or ground lamella. And it's actually the second portion of the middle turbinate. Because remember at the beginning where I showed you the middle turbinate, it was straight down. As you go back, you get the second part of the middle turbinate, which starts to be more horizontal. So this is the basal lamella there, and it's attaching onto the lamina preparatia. So when we do our operation and we trim the middle turbinate, we don't want to trim too much off because that makes us at risk of damaging the lamina preparatia. And superior turbinate, so remember there are 3 turbinates on each side. The superior turbinate is the very top. The space between the superior turbinate and the middle turbinate is called the superior meatus. The space between the middle turbinate and the inferior turbinate is the middle meatus, and then the space below the inferior turbinate is called the inferior meatus. So I wanted to explain the middle turbinate in a bit more detail because it's quite another of those tricky pieces of anatomy to understand. So the straight down area at the front, the anterior segment lies in the sagittal plane, so it's like this side on. It's a vertical part. But as you go further back, you get the second part, and that's the ground lamella of the middle turbinate, which goes out laterally, so which goes out sideways to attach onto the orbit. It also has a third part, so that's the part that goes back in the nose and also attaches, you'll see later on, that also attaches on the side wall of the nose. So 3 parts here in the schematic. Vertical part starts to go more laterally as you go back. And we're reaching the end now, so you've got the sphenoid, coming to the sphenoid sinuses now, and that's a sphenoid ostium which drains into the superior meatus area, which we talked about. And you've got the last remaining bit of septum before you start to lose it, and so the nasal cavity becomes a common area at the back. That's just a sphenoid intersinus septum, so it's just a partition in the sphenoid sinuses. Nasopharynx, so that's when the nose connects to where we swallow and things like that. Yeah. Okay, so now we'll go to, are we all right for time? Okay, so this is even more tricky, MRI sinuses, because it's hard to identify landmarks in the MRI sinus. It doesn't give us the contrast that we need. But you can still normally identify the landmarks. I think it might help to turn the light off, or because it's really hard to see. Was it just these? Yeah. So again, we're starting at the front. The first sinuses you'll see are the frontal sinuses. You've got the cartilaginous septum. So that was in this in this plane here. Going back, you start to see the aganasia as well below the frontal sinuses. Maxillary sinuses coming up. So all the sinuses look black. Just a bit further back, and now we're going towards where the frontal sinus drains into the nasal cavity. That's that really narrow area. It's really hard to see on this, in this room on the screen. But okay, so this is the uncinate process, and normally you would see it because I think it's blown up, so it's quite pixelated. But it was going towards the orbit, which meant that the frontal sinuses were draining into here. And you can see on the other side, you've got the uncinate process. You can see the middle turbinates, vertical. Going back, the OMC, or osteomeatal complex. On this side, you can see the maxillary sinus will drain by a little hole here into the middle meatus, or into the nasal cavity. This is a normal patient, so it's very, very small. In a post-op patient, it'd be much wider and you could see it more clearly. And the ethmoidal bulla, those are the ethmoid air cells between the eyes and the midline. Bit further back, you can't really see it in this zoomed in view, but the middle turbinate is here, and it's going more laterally now instead of vertically down. So that's dividing the ethmoid sinuses into anterior and posterior. So that's that's the middle turbinate dividing the anterior and posterior ethmoid sinuses. You could also see it on the right. You can't see it that clearly, but yeah, that thin line here. Going further back, you don't have the anterior ethmoid sinuses anymore, the posterior ethmoids, and then you've got the third part of the middle turbinate, so it's very horizontal now instead of being vertical. Yeah. And finally, sphenoid sinuses with an intersinus septum. Sphenoid sinuses are in the sphenoid bone, and part of the sphenoid bone is called the rostrum. That's the projection that comes down here. And you can see now, because there's no septum, the nasal cavity is a common area at the back, and you've got the last bits of the inferior turbinates that you see here, and the nasopharynx. So that's it. I was going to show you a post-op CT scan, but we don't have time for that, unfortunately. Yep.
Thank you.